4. All righty, here we are, Dr. Wong and Dr. DiVita here to answer your questions live about dogs and cats with neurological conditions, seizures, paralysis, balance problems, stuff like that. If that is what's going on with your pet, or if you've got questions about that, feel free to jump in and put your question in the comments. We've got a couple questions that were submitted ahead of time that will hopefully get those people on here with us to answer their questions. So the couple of things that we usually throw out there, just, without being able to see your pet in person, it's challenging for us to give very, very specific information. There's so much that we see based off of evaluating in person and laying hands on your pet and being able to review the records, etc. So we may be a little bit limited in what we can give you here, but we'll do our best to be as useful and helpful as possible. Couple things, we are hiring. We just opened our Jupiter location fall of 2020, so we are in search of hardworking, fun-loving, pet-loving individuals that are humble and just want to make a difference in the world. And if that's you, give us a reach out to hr@sevneurology.com. We're also hiring in Boynton Beach and Miami as well. So without further ado, I guess Dr. DiVita, I know they've met you before, but if you want to kind of introduce yourself a bit.
Yeah, so I'm Dr. DiVita. I'm the second year neurology and neurosurgery resident here at Southeast Veterinary Neurology in Miami. I think I just hit, or tomorrow will be my halfway point through residency. So we're almost there.
All downhill from here.
Oh, don't say that. Just, happy to help even from afar and meet people from all over. And, we like to do this. So I'm excited to be able to interact with some people today. We've been missing that with COVID and our inability to have our owners here with us.
Yeah. So I see Chris and Nala just joined us. So I'm going to bring Chris and Nala in. Hi there.
Hi, guys.
Can you hear us all right?
Hello.
Hi, thanks for having us.
Oh, thanks for
Absolutely.
jumping on. I love your background color. That's very Southeast Veterinary Neurology-y. So, what's going on with Nala?
Well, so do you mind a little backstory? Cool. So she was diagnosed with Horner syndrome in late August, and the vet told me it was idiopathic and I shouldn't worry about it. But then a month later, she was diagnosed with vestibular syndrome, and it looked pretty bad at the beginning. I rushed her into the ER because she couldn't walk and she peed her bed, and that was totally unusual. She was put on doxycycline and steroids for 2 weeks. And her mobility improved, but the head tilt didn't really, and neither did the eye. And then we tried cephalexin for 6 weeks, which we just finished. And her head tilt's better, but the eye is still presenting as Horner syndrome. So I'm just not sure if I should consider this a recovery because her mobility has greatly improved, or if I should keep trying to figure out what's going on.
Mm-hmm. Did they do any testing at the ER or any blood work, anything like that?
Yeah, so they did blood work, and it showed mildly elevated liver enzymes, which is why she was put on doxycycline. And then it showed a problem with her gait that they didn't say was necessarily painful, but I'm not sure the details, but they said there was a problem with her gait. They checked her ears, but they didn't see any inflammation or anything, but she hasn't had a culture done.
Okay, cool. And how is she doing now? So you said she still has the head tilt, that hasn't resolved, but her mobility is much improved, and the eye is still a bit abnormal?
Yeah, the eye still looks abnormal. The head tilt's better than it was. I mostly see the tilting when she's walking or running, but but because I know what's been going on, I can tell it's a little bit tilted. But
Yeah.
she's 14 and she still gallops around the dog park. You know, she's still faster than I am. So I don't know if I should keep poking and prodding her or if I should just, you know,
Yeah.
I just don't know.
Yeah, well, if you're okay with it, I'll kind of talk, and if you're okay with it, Dr. Wong, I'll talk a little bit about the anatomy of the Horner's pathway and then of the vestibular system as well. So Horner syndrome is kind of a collection of clinical signs that indicates dysfunction of a very specific nerve or kind of group of nerves that control a lot of what the eye does, essentially. And the main clinical signs that we see that compose or comprise Horner syndrome is a droopiness of the eye. So kind of the eyelids will droop down. They can have sinking of the eye. So the eye that's affected looks like it's sunken into the head more than the normal eye. They can have kind of a smaller pupil. So that can be hard to see at home sometimes, but the pupil on the affected side will be smaller than the normal pupil. And they can also have a little bit of, tearing of the eye, things like that. When you look into the eye, you can also see abnormalities with the blood vessels in the eye sometimes. That's obviously not something you'd be able to do from home, but something that your veterinarian might be able to see. So the Horner's pathway, basically those nerves that control all of those things in the eye, travels from the brain down the spinal cord in the back, and then takes a quick turn and kind of into the chest and back up to the head, where it innervates the muscles that surround the eye and the muscles that control kind of the size of the pupil. So there's a lot of places in that pathway that could be affected. When it turns around and goes back to the head, it also runs right around that inner portion of the ear that we're unable to see from the outside. So that's the part of the ear that's past the eardrum, and we can see up to the eardrum when we look externally. So really anywhere along that pathway could be affected to cause a Horner syndrome. When we have a vestibular syndrome, we worry about a problem either affecting the middle and inner part of the ear, that deeper part of the ear, or affecting the back part of the brain. So unfortunately, those two pathways do share, a lot of the same localization and a lot of the same places in the nervous system that can be affected to cause the clinical signs. So, first and foremost, looking in those places is reasonable. There are a lot of possible causes for both Horner syndrome and vestibular system. Middle and inner ear infections are one of the ones that could easily tie the two together, right? Because both of those pathways share that commonality. We can have a low thyroid level, which is why I asked if they had done any blood work that can affect both of those nerves and the function of those nerves. So that would be something easy to test just to cross off the list if it's not something that had been done already. Especially in an older pup, sometimes the thyroid level can sink down, and that can definitely affect that function. And again, it's not invasive, it's a blood test. So that's something you could consider, your veterinarian could consider. There are idiopathic syndromes as well. So you can have idiopathic Horner syndrome, and there's a small percentage that will be accompanied by idiopathic vestibular syndrome too. I like to describe that almost like vertigo in people. So when I'm having my owners relate to that, most people kind of know what vertigo is or know someone who's had vertigo. There are also, unfortunately, more sinister things that could be going on that can affect both systems. And that's where some of our imaging will come in, doing things like MRI of the brain and the neck to look at that entire Horner's pathway. The MRI also allows us to evaluate the inner portion of the ear. And we can even do chest x-rays to look at the portion of the Horner's pathway that's in the chest too. So there's, in these situations, so much testing that can be done. But to answer your question of what do we do from here, if she's improving dramatically, I think you have kind of two reasonable options, maybe more than that, but two reasonable options. Number one would be if you say, gosh, she's doing really well. She has the head tilt, but it's not affecting her day-to-day quality of life. Then maybe we keep watching her and we say, okay, I like to tell my owners some dogs with vestibular syndrome, no matter what the reason is, may always retain a bit of a head tilt, even if they've fully recovered from whatever the cause is. I tell people it gives them character. It's more cosmetic than anything. And, she'll be the funny dog that outruns everyone else with her head hanging this way. So that would be one possibility, is do we just let it be and continue to monitor her since she has made dramatic improvements? The second possibility is you say, gosh, I don't want to leave this alone. I want to make sure there's not something more going on. And you consider some of that additional testing. Again, the thyroid test is easy enough to do. Past that, doing some chest x-rays, that's also pretty easy to do, non-invasive, doesn't typically require any anesthesia or sedation. And then the last part of that testing is to jump into that MRI scan, which, of course, would require a visit with a neurologist and anesthesia. So that's something you'd have to consider. There are pros and cons to doing such, but that would be the last kind of recommendation if you were to choose the testing route. But I think based on what you've described, it sounds like she's made some improvements. She's otherwise relatively unaffected. And I think that it would be definitely reasonable to sit with option one if you were happy with where she was at right now.
Okay.
Yeah.
Awesome. Thank you.
Yeah, of course. Dr. Wong, do you have any?
Not much to add. I mean, just all of the same things. Just when we hear head tilt, is the head tilt towards the same side as the droopy eye?
Yes.
Okay.
Yeah.
So when we have those signs together, it points to a very specific place. That's kind of where those two pathways intersect. So the likelihood is that that's where the problem is. Sure, could we have two unrelated problems? But the likelihood is that that's where they're intersecting. And yeah, like Dr. DiVita said, ear infection, idiopathic, or something a little bit more worrisome like a tumor would be kind of the big things. And really the only way to know for sure is by doing testing. But we get it 14 years old, improving, and we've got some things on our worry list that either get better or stay the same. They don't get worse, on their own, or the treatment is antibiotics, which you're already treating with. I guess one of the things, I don't know if you talked about, when we talk about middle and inner ear infections, one of the things that I commonly see is the ear infection or the suspected ear infection is only treated for a short period of time. So, we get antibiotics for 2 weeks or 10 days or something like that. And sometimes those pets can get better, but when it's a really deep ear infection, that usually requires long-term antibiotics, so 8 weeks of antibiotics. So usually my approach, if we haven't gone through these steps of proving that it's an ear infection and or culturing the ear to find out what specific type of infection it is, we're at that point, we're sort of left with what we call empirical therapy, or kind of a best guess based off of what type of bacteria frequently happen in the ear, and we'll treat for 8 weeks is I guess the minimum for me. So one of the pitfalls that I often see is dogs treated for 2 weeks and gets better, but then we stop the antibiotics, and 2, 3, 8 months down the road, symptoms come back, not because we weren't treating the right thing or that it wasn't an ear infection. It was just that we undertreated. So I guess that would be one of the things for me to add there. But really, you're at that sort of crossroads, and it's a tough crossroad when we've got, a 14-year-old gal that's getting better but hasn't resolved, for us to make that decision of, do we jump in or do we stay the course, or kind of that third option is, do we dot some I's and cross some T's, as I call it, of, the thyroid testing, ear cultures, etc.
Yeah. She finished a 6-week course of cephalexin a few days ago. Should I ask my vet if I can get an additional 2 weeks just to be safe?
I guess the 8 weeks isn't a magic number. I guess the point I was trying to get there is, many times it's kind of a 10 to 14 day course, which, to me is sort of undertreating. I used to say 6 to 8 weeks. Now I kind of just say 8 weeks for simplicity. So, okay. But going to your question, absolutely, you should ask your veterinarian, based off of he or she being able to evaluate Nala in person, be able to look in the ear, see how the ear is doing. You know, is it red? Is there still material in there? What does the eardrum look like? Are all things that they'll likely take into account with regards to should we continue treatment or not.
Okay.
And at that same appointment, you know, that to me would be the time to talk about, you know, do I run some blood work, thyroid? I guess I don't know, Dr. DiVita, if you talked about chest X-rays. Occasionally for dogs with Horner's. So X-rays of the head don't give us a whole lot to say, is there an ear infection? But occasionally with more sinister causes of Horner's syndrome, just because that pathway starts in the brain, makes its way down the neck to the chest. Sometimes on a chest X-ray, we can see something that might give an explanation for the Horner's syndrome. So I guess that would be the other middle of the line approach, you know, with the blood work, with the looking at the ear, would be considering some chest X-rays.
Okay. Do I have time for one more quick question?
Yeah, please.
So right before she was diagnosed with Horner's syndrome, I noticed she just all of a sudden developed this like really weird sensitivity to sound she didn't anticipate. Like when I'd open the door or like open a bag of chips or open a can of soda, she would kind of just go like this. And that's something that has not gotten better at all. And I don't know if the two are related or if it's just a coincidence, or if you ever see that happen with Horner's or vestibular.
You want me to jump in here?
Yeah,
Oh,
I don't think I've heard that reported, but I guess it would make sense if there's an irritation or inflammation in the ear from an infection. That's, I guess, the way I could correlate it in theory.
Okay.
I guess one of the things I do is try and get a video of it, and if it's what I'm picturing, what you're describing, I know it can be hard because it's just this real brief thing, but if it's something that you're able to elicit by opening a bag of chips or certain sounds on the TV or, you know, lights, when I hear something about that, I think of something that I don't really relate to vestibular disease or Horner's syndrome, but some dogs can get an atypical seizure that is sound or light induced that is sort of that, what I'm envisioning from what you've described is just, you know, that bag of chips opening, just kind of the head pulling back and it just being this real rapid oscillation of the head. I usually see that as a standalone condition. I usually don't see it along with the Horner's syndrome. I see her back there. I don't see it along with the other two things. Again, I think we're just sort of piling up some of the reasons why it might be of benefit to, you know, to meet with a neurologist. You know, when we start making the recommendation towards doing tests, we're kind of, you know, weighing the pros and cons. You know, what's the likelihood of us getting information that changes what we do, you know, versus what are the downsides, being anesthesia and costs associated with it. And when we start lumping in things like, well, we've got Horner's syndrome and we've got a head tilt, and now we've got these episodic head movements or myoclonic seizures, as I guess is what I'm envisioning based off of what you've said. All things that would point towards doing testing that looks at the head. You know, the scales are sort of tipping, you know, this way for me. So
For sure. Okay, thank you guys. I really appreciate it.
you got it.
Absolutely.
All right. Thanks so much.
Yeah, have a great day. You too.
All righty. That was good stuff. We've got Marietta, and she's got a 10-year-old female Shih Tzu named Egg Roll. I guess tell us a little bit about Egg Roll.
Hello, thank you for having me.
Oh, thanks for jumping on.
Egg Roll, about 2 years ago, started with weakness in her back legs. Like when she would stand, they would shake a bit. but she got around fine. And after she went potty, she would want to just sit down or lay down, and her legs would shake. So I got her some Cosequin, thought maybe it was old age and it would help. And then in May of 2020, we went for a car ride. She was fine. And when we stopped, I just opened the door and just reached for her in the car seat to pick her up. And she yelped, but I hadn't even touched her at that point. So I took her out. She really didn't want to walk, but she could walk, and she didn't have any visible problems walking. On the way home, she was kind of like breathing heavy. So we went to the ER vet. They did x-rays. They didn't find any tumors or anything. Gave her some gabapentin and carprofen, I believe, and said to follow up with our vet, which we did. He felt she had maybe IVDD. I think he said cranial to L3, maybe. I can't remember. And he suggested 6 weeks of rest with the meds, which we did, and she was great. She was fine. Then in October of 2020, she got groomed, and immediately after the grooming, she seemed weak. Her front legs kind of bowed out, almost as if she was having a hard time holding her weight up, and the shaking in the legs started. So took her back to the vet. We did prednisone. Actually, I took her to a neurologist after that episode, and they suggested they did x-rays again and blood work, and suggested MRI the following day followed by surgery, which I agreed to, and then thought about it overnight, because when she woke up from the anesthesia, she was really not walking good at all. Completely different than she had been when she got there. She had the drunken sailor walk. So I was a little nervous about the whole thing, and not being able to sit down and really talk to the neurologist one-on-one about it. So I held off on the appointment. So they suggested go back to the vet, get prednisone and gabapentin, and do some more crate rest, which I did. And she gets around really well, but she just always has that weakness. I'm not really sure what to do, if I should do surgery or continue when she has flare-ups to do rest and medication.
I missed what did the MRI show?
They didn't. I didn't do the MRI. They wanted to do
Oh.
the MRI and then immediately take her to surgery afterwards, and I just didn't understand that. It kind of just didn't set right with me.
I misunderstood. I thought you had said you did the MRI and she was worse after the MRI.
That was X-ray.
Okay.
They had sedated her for an X-ray, and when she came out off the anesthesia, that's when she had the drunken sailor walk, and that took about a week to get that to go away.
And just to clarify too, the second episode that she had, you said the front legs were also weak, or just the back legs?
Her front legs were bowed, like she looked kind of like a person when they're bow-legged. And she was stepping up about maybe like a 1-inch step, and she stumbled a bit with her front legs.
Okay.
And just a few days ago, she was stepping over like a slider door track, and she cried out, just a little yelp, and she turned around and came right back in the house. So I wasn't sure if she had stepped on something, or if stepping over, like, that 3 inches or whatever that is, if that caused her to be, have some pain somewhere.
Yeah. Okay. And is she on any medications right now, or she's all finished with them?
Yesterday she finished.
Okay.
So she's getting around well, except for just that shakiness that she has. I don't take her on walks anymore. So she has a little yard that she can potty in. She'll try to run from me, if I want her to come inside. And she doesn't have a problem doing that.
Yeah. So Based on what you've described and what your veterinarians, the course that your veterinarians took to send her to a neurologist, I would presume that she has a spinal problem. When we have only the back legs being affected, that more indicates a middle to lower part of the back spinal problem. But when the front legs are affected too, that indicates a problem affecting the spinal cord in the neck. So basically we split up from the shoulders forward and then from the shoulders backward. Shoulders forward affecting front legs and back legs, backwards affecting just the back legs only, if that makes sense.
It does.
Perfect. So when you described initially just the back legs being affected, that would have made me concerned more for a back problem. But with the second episode of having the front legs being affected, that would make me more concerned for a neck problem. And there's kind of 5 grades or categories of spinal cord problems in dogs. We grade them on a scale of 1 to 5. A grade 1 is a dog with pain only. So that's the least severely affected category. The dog is otherwise normal. A grade 5 is a dog who cannot move the legs, so is paralyzed, but also cannot feel the toes. So when we pinch the toes, there will be no response to that, that discomfort of having the toes pinched. So it certainly sounds like egg roll is, on the less severely affected side of that scale. And it is reasonable in a lot of cases to manage dogs in that way. However, we also don't know with certainty without doing testing what she has. So a slip disc is in the neck and the back is far and away the most common thing that we see. So if I had, again, this is based on your description, but if I had 100 of egg roll and she did truly have a spinal problem, in the neck or the back, 97 of her would probably have a slip disc. There's those other 3 or 4 that would have a variety of other problems. And that's where doing that MRI comes in, just to confirm our suspicion. And probably what your neurologist was, trying to make sure that, yes, this is a slip disc that would be amenable to, a surgery. So operating under the assumption that a slip disc is the cause for her discomfort and some of her weakness and difficulty walking, you have 2 approaches to treatment. And the first is what you've been doing. So that rest and medications. And for dogs that are, less severely affected, like a grade 1 or 2 on that 5-point scale, rest and medications is reasonable. The other option is surgery. Surgery comes with an improved percentage of dogs who fully recover. About 90-95% of dogs who do well after surgery, they recover the ability to walk well and they're more comfortable. So there are definitely pros and cons to doing both. With the rest and medications, as you've already seen, there can be recurrence of the clinical signs. There can also be recurrence with surgery, but the percentage of having recurrence is higher when we do the conservative approach, the rest and the medications. So about 50% of dogs with a slip disc will have another spinal problem in the future with option 1. Only about 15% will have another spinal problem in the future with option 2. So certainly doesn't totally eliminate, the possibility, but it definitely makes it much lower to have recurrent spinal issues. Right. Now for egg roll, being as though she's what I would call a repeat offender, meaning she had the episode, she recovered, now she had another episode. Do we consider making sure there's not something more sinister going on by doing that MRI scan, but B, seeing if it is something that would be amenable to surgery, to nip it in the bud and say, let's avoid having, repeat offense number 3, essentially. So that would be kind of if I were seeing egg roll, kind of the conversation that I'd be having with you to say, I don't want to see her again for a bad reason. If you're up for surgery, realizing that it requires anesthesia, that there's a financial commitment to doing surgery, and surgical risk, even though the surgical risk is relatively low, there's always a risk to any surgery. Maybe we do head more in that direction just because of the repeated nature of her difficulties. So I think, again, there's a lot of unknowns in that we, don't know with 100% certainty that she has a slip disc that would be good for surgery. you know, and not knowing too, how's she going to recover from this particular event? It sounds like she's doing relatively well. But certainly I'd be a little bit worried that she'd have, you know, in a few weeks or months, another episode of the discomfort and the difficulty walking. So that would be my, you know, kind of my input. I don't know if Dr. Wong has different input.
Yeah, I mean, in general, for me, and I think I'd like to talk about, you know, your concern of the rationale of going straight from MRI into surgery as well. But for us and for pretty much all neurologists, you know, we don't want to do surgery just to do surgery. We're doing it because we think it's, you know, the likelihood of it helping the pet far outweighs the risks. And there are risks of any surgery. So for me, when do I consider proceeding with surgery, you know, as opposed to trying a more, or I guess a non-surgical route? The things that Dr. DiVita talked about. I mean, one, the severity of symptoms. You know, when we're relatively mild, we give the option, or it's more reasonable to try a non-MRI surgical route. You know, and with what's going on with the egg roll, where it sounds like it's relatively mild, you know, that was a reasonable way. To me, the second reason that I would, and I'm going to change your question here, consider proceeding with MRI to determine if surgery is necessary, I guess is how I'm going to answer the question, is also just based off of, well, what's the signalment of the dog? Meaning that we classically see IVDD is very common in certain breeds. So, you know, if it was a French Bulldog, a Dachshund, a Shih Tzu, things like that, 10 years old like egg roll, you know, where IVDD is high on my worry list, that applies with the idea of, well, gosh, you know, for the more mildly affected, it's reasonable to take a watch, wait, and see, or a conservative approach. Whereas if, you know, this were a, I don't know, a 12-year-old boxer dog, or, you know, just something that isn't a classic IVDD breed, we're more likely, even with the more mild symptoms, to proceed with or recommend tests. The next reason for me to consider moving to that next step of tests and surgery are if symptoms are getting worse, or if they're not getting better, and that, or if they're recurrent. So meaning if it's kind of early on and we're a category 2, but, you know, 2 weeks later we're still painful, that to me is a reason to shift gears. Obviously, if we're getting worse, if we've gone from walking to not walking, that's a reason, you know, or kind of in egg roll's case, you know, 2 years ago, this started, and we've had, you know, repeated flare-ups. That to me is another reason to consider tests to find out, well, gosh, are we actually on the right track with assuming it's a slip disc? And is it something, not that there's an exact grading scale that if we do an MRI, we can 100% tell, yes, this is a dog that's going to get better without surgery, or this is one that needs surgery. But we can often get a sense based off of the severity on the MRI of saying, hey, you know, this is a dog that would do better with surgery than with rest and medications. So I guess that's my question to your question. That's my answer to your question of when should I consider proceeding with surgery is it depends, but in egg roll's case, you know, the things that where I would say it's time to shift gears is if this current episode doesn't get better, or if, you know, a third strike and you're out, so to speak, you know, where, you know, this time we have a hint that maybe the front legs are affected, which is a little different than 2 years ago where it seemed to be mostly, you know, just trembling of the back legs.
Okay. And no therapy or anything like that, no back brace, nothing.
So I think I tend to oversimplify and sort of break it into, you know, MRI and surgery versus a non-surgical route. And to me, that includes the crate rest for the immediate period when it's going on, physical therapy, acupuncture, you know, avoiding high impact activities, etc. I haven't seen it come up in the comments, you know, yet, but I'm sure someone will ask about, you know, CBD oil. Someone will ask about stem cell therapy. I suspect that will come up soon. You know, the answers to those are, you know, we don't necessarily know the answers to that yet. So but that is something that's being looked into. So.
Okay. So my next step should be MRI probably then.
If this current, and forgive me if I don't have the timeline right, my understanding is right now we're doing all right, and the trend, the uptick has been here. Is that accurate?
Yeah,
So,
she gets around good, except for you can tell she has weakness. Like I can see that she shakes here and there, but she is getting around.
when was the last time you saw your neurologist?
November.
Yeah. So I guess that's where that's where I would start off. Obviously, you know, if you're concerned enough to be on the call or on the video chat with us, you know, it's something that hasn't gone away. To me, this is where, you know, them seeing, because they've seen her before, they'll be able to better say, well, gosh, this is better, worse, the same. Something that I talk with my pet parents about is, you know, you see egg roll every single day, whereas if I saw her 3 months ago and I see her again in January, you know, I might notice a more dramatic difference than you. And oftentimes we can be, I guess, you know, less biased in it. Many times owners, you know, want their dog to look better, whereas we see it and it's like, oh, you know, yes, this is much better, or hey, this is, you know, this is worse. So I want to. Are you still there, Marietta? It looks like you've frozen a little bit. Can you hear me at least?
Yeah, she's frozen for me.
Okay. I'm still going to answer it here. So we often will talk about going straight from MRI into surgery, and it's not so much that we're trying to rush anyone into surgery. It's more if, and this is why we spend so much time prior to MRI talking about the different scenarios that we can get into. If it's a dog that we have a high suspicion for it being a slip disc, and we've made the argument to do anesthesia, to spend the money on an MRI, if it's a slip disc that we feel that we've got.
Sorry, I lost you somehow.
It's all right, perfect. I saw you come up there again. So I was just starting to talk a little bit about you know, the idea of going straight from MRI into surgery, because occasionally we will you know, have someone that's their concern, and you know, kind of these yellow flags or red flags go off, you know, and it makes them concerned. Well, gosh, you know, are we rushing into something? And it's not so much that we're rushing into it. We're at least our approach here, and my assumption of what your neurologist approach is, was, you know, if it's something that we've made the argument to take on the risk of anesthesia, and and the cost of doing an MRI, if we find an obvious slip disc where we've got great chances of fixing it, because this is the #1 condition that we see affecting the spinal cord as neurologists, we have the ability to go straight from anesthesia for the MRI into surgery. And it's not so much that we're rushing, but, you know, for me, it's if I've gone through the you know, the mental hurdles, and I've made the argument that this is what's in the best case for my patient of doing the MRI. If that MRI leads to the next step is, well, in order for me to make good use of the money and the anesthesia that we've taken on here to actually fix it, and I've got 95% chances of fixing it, that's where we have the ability under the same anesthetic period to go straight to surgery. But whenever someone like you says, well, gosh, why are you doing that? You know, I sort of, you know, one, spend more time talking about that so that you understand the rationale there. But two, sort of reiterate, you know, hey, you're driving the bus here. If you say, I want to take it as stepwise as possible, I want to do the MRI and not necessarily go into surgery, I understand the rationale, Dr. Wong, of why, you know, you're talking about going to surgery afterwards. You know, in the end, you're in charge. Our approach and your neurologist's approach is, you know, to give you as much information as possible so that you can make the informed decision. So
Makes sense.
Okie dokie. So I guess in summary, I'd have your neurologist take a look, see, are things better, worse, the same. And to me, if they're better, you know, I think you're on the right track, and I would just be prepared. Okay, strike 3. That's what I'm going to go finding out. If we're the same, I kind of coach my pet parents through the thought process of what's keeping me more up at night, the anesthesia and the cost of doing an MRI, or the not knowing what's causing my dog to have these issues, if we're kind of the same. And obviously, if we're worse, you go and you see your neurologist and they say, hey, based on my records and what my recollection of November was like, we're 20% worse or whatnot. That to me would be a reason to proceed with testing at that point.
Okay. Makes sense. Thank you.
All right. Well, I hope it was useful. I hope when you go and see your neurologist, they say, nope, she looks great, and she continues to improve, and you can avoid those things, but exactly.
All right. Thank you.
You got it. Take
Right.
care.
Have a good day.
You too. Bye-bye.
Bye-bye. All righty. So we've got, and I'm sorry, Bridget, I'll bring you on in a second if I pronounce Fira's name incorrectly, but she's a 3-year-old female French Bulldog, and let's add you in there.
Hi.
Hello, hello.
Hello.
Is
Can
my
you
mic
hear us?
working?
I can hear you.
Okay, perfect. All right.
How are you?
I'm good. How are you? And it is Fira. She is
Fira.
right here.
Oh.
Hey, kiddo.
Yep. So she is 3. She's a Frenchie. And on Halloween of this past year, she gave us the fright of IVDD symptoms. We thought that she had ate something that was bothering her because her stomach was like rock hard. She was super shaky, panting, but she was walking beautifully. So we brought her to the ER. They did all these tests, and then we brought her to our vet, and our vet said you should really get her to a neurologist just because she wasn't really aware of where her back legs were in space, if that makes sense. So we brought her to the neuro, and being the overly concerned pet parent I am, I said, do the MRI, do everything. Thank goodness for pet insurance. And the MRI, she was at the neurologist. They kept her for about 3 days because the MRI showed that she does have a compression, but they said it wasn't overly severe. The neuro said that she wouldn't be what they would consider an MRI dog, if that makes sense. He said, she walked in here. She didn't seem to be, like a dog that he would say, let's do an MRI, let's do surgery. He said, crate rest, but I just wanted the MRI just to know. So she stayed there for 3 days, and he said to me, we'll keep her for, 3 days, and I'll assess her every day. And if she doesn't get worse on day 3 than she was on day 1, I strongly suggest that you just do the crate rest, because why, put a dog under surgery if it's not completely necessary. And of course I wanted her to have the surgery because in my mind, that's how I would know it was gone. But, he is a neurologist and they know best. And so that was Halloween. She was strict crate rest up until early December. So we did about 6 weeks. She went back for a checkup. He was very happy with it. And honestly, I really can't tell the difference in her now than prior. We're very, very careful with jumping and running and all that. So my question mainly is, she stretches a lot now. So when I say that, I mean, she does a lot of downward dog. And then after she finishes that, she'll kind of kick out her back legs. She doesn't seem in pain at all. She really hasn't seemed in pain to me. And she has unfortunately done a couch jump or two if I'm not, right on her. But would you be concerned about the stretching or?
Yeah, I guess first of all, we're glad to hear that she's doing well now. And the second point that I want to hit before I forget to hit it is cannot stress enough how important pet insurance is. So,
Oh my God.
so we're
Yeah.
so happy for you that you had that already set up. So just for everyone else listening, super important. We can probably talk more about that, at a later time, but that's my soapbox and I'll get off of it now. I guess if she seems comfortable, if she's walking well, if she's not crossing her legs, scuffing her toes, doesn't look drunk in her back end, essentially, I wouldn't be terribly concerned. Maybe she has a little bit of tightness of those muscles. You could certainly employ things like massage or even warm packing to rule that out as an option. The same things you or I would do if we had tightness of our muscles. I guess I haven't seen, that correlation essentially. So I haven't seen other pets or other French Bulldogs who have a slip disc, who we know have a slip disc, who have the stretching afterwards, whether they have surgery or not. The other thing I'll just quickly mention, which doesn't sound like it's the case, but that sometimes when dogs do that kind of almost praying position stretch, it can indicate belly pain. So I would just double check, with your veterinary next time you visit and make sure that she's not uncomfortable in her stomach. Or if she had any vomiting, any inappetence, nausea, obviously then we'd say, okay, maybe that's the cause for this. And we should look a little bit further into the belly.
Oh, yeah. I made them do an x-ray of her stomach and all the blood work because I wanted to rule that out because her stomach was really, when it first happened, it was really hard. And they're like, yeah, nope, there's nothing in there. She's always been a lot of us. She loves to stretch. I think my concern is, in your opinion, in a dog that didn't get the surgery, we're super careful now. What would you be a red flag that I would be concerned about, I guess?
Yeah. So any of those things you saw initially, and in French Bulldogs, they can have such a variety of clinical signs, and their clinical signs can change dramatically from 1 minute to another, seemingly. So the things you saw on Halloween, the getting really tense in the belly, really just kind of trying to protect herself and guard her back. A lot of times we will see dogs that seem like they had an abdominal problem. And then we figure out later on that it's a back problem, just because that's one of the ways they protect their back and protect themselves when they're uncomfortable. In French Bulldogs, we will see them kind of panting a lot because of their discomfort. Obviously, that's a little bit exacerbated by their, funny short snout and the way that they breathe anyway. But if you see her panting and, kind of seeming restless and uncomfortable, that would be an indication to me to say, is she painful somewhere, be that her back or her abdomen? And do we, visit our veterinarian or our emergency veterinarian? And then the obvious things, the weakness in the back legs, the crossing the legs over, scuffing the tops of the toes on the ground. So one of the things you can do at home is check her nails in the back feet. If they're getting really worn down, as I see you looking at her feet right now, if they're getting worn down, that's an indication that she might be just scuffing those while she walks, which can be that indicator of not knowing where the legs are in space. That's more of the subtle things that you'd be looking for at home. And then, of course, sorry, go ahead.
So it's been since Halloween, so a little over 2 months, and stop. And so my big concern was her back legs aren't super strong right now because she went from walking 4 miles a day to nothing for 2 months. So we're up to 1.5 miles now. She walks beautifully, but if we are on a slippery floor, she will get a little drunk. And when she's say she shakes herself out, her back legs will kind of get a little clumsy. Is that the nerves kind of regenerating? Because I took her to the vet because I was like, there's still something wrong. And they basically said that could be her new baseline. That could be nerve regeneration. I don't think you should be worried about that because she's walking,
Yeah.
So I guess anytime if she's playing with a toy or something and she's not focused, sometimes a paw will knuckle for a moment and she won't adjust it right away. So would you consider those to be concerning, or would you attribute that to the nerves regenerating and potentially a new baseline?
Yeah, I think concerning is not the word that I know that I would use, because I don't want to raise alarm. It certainly can be indicative of this may be her new baseline. We know she has a little bit of compression. We don't always reach 100% of recovery, even when we do surgery sometimes, frankly, depending on the severity of the situation and each particular pet. But maybe that's likely going to be her new baseline. One of the things you can consider and certainly chat with your neurologist about is, do we get her into a little bit of a physical therapy program?
Yeah, I've asked, I really want to. And they were like, you definitely can, but we don't even think that she needs that. They're like, well, controlled leash walking is enough. I think I'm just over eager.
Sure. Yeah, it's something you can consider. It's not going to hurt. And I like to kind of correlate physical therapy in dogs in this particular situation to you or I going to the gym. So the overall goal would be to improve her strength and her muscle tone and that like kind of last bit of coordination that she may be lacking, and keep her as in shape as possible. Because just like you or I, the more in shape that she is, the less likely that we have a problem in the future. Not meaning it's 100% that she won't have a problem in the future, but it's definitely something to consider. And again, it's not something that'll hurt. So at least a visit with a physical therapy veterinarian might be beneficial, just to get their input and see if they have any recommendations either for at home or in the hospital physical therapy.
And then another question is, when you see dogs come in, I suppose you kind of understood what I said when the neuro said she's not really an MRI dog. I would have, done the crate rest and we'll go from there. So I suppose in my mind and all the research I did, I was like, we got to get the surgery. She's going to recover better if she has surgery. Do you agree that there are some cases that you have seen that the dogs do the rest and recovery and recover well?
Yeah, absolutely. And even in cases more severely affected, we see the gamut of cases who are unable to walk and for one reason or another don't pursue an MRI or surgery. And then the next week they run on into the clinic and so we definitely do see them recover and see them recover on a permanent basis. It is absolutely appropriate to take that route. We were talking on the last call about some of the some of the things that we use to decide when do we do MRI, when do we do surgery, when do we not do those things. And the less affected dogs certainly have the option in most cases not to do that MRI or surgery and still be a very reasonable and very safe approach. And that's probably what your neurologist was hedging towards, is that I think we can get away with not doing so. But it's also not wrong by any means to do it, to have that peace of mind so that, kind of like Dr. Wong said on the last call,
pet
so
insurance.
that you can better at night. Yeah, pet insurance. It's the best. Yep. But obviously it sounds like she's doing quite well. And I certainly think you're on the right track. I definitely think you've obviously taken really good care of her. So, keep it up and keep that pet insurance. And hopefully we won't have to worry again in the future, but we know we have it if we need it.
Yep. And then the last thing is, along with the stretching, she seems to, when a dog is wet and they shake their body, I don't know what that's shaking. It's not like tremoring shaking. It's how she would shake herself if she was wet or if I put a sweater on her. She does that often when she gets up from lying down and she's transitioning. I think it's kind of more her figuring out where she is in space with the nerves in her back feet. So once again, I'm going to kind of attribute it to the nerves regenerating, and perhaps this is her new baseline. But I just want to know if you guys saw stretching or shaking herself as something that you'd say, oh, bring her back in. Let's get her into surgery.
Dr. Wong, you can take that one.
No. I guess is the short answer. All the things that Dr. DiVita said before, the things that I would be looking for are the more, I won't say dramatic things, but are the more solidly neurological things. I'm hurting, so kind of the opposite. Like I won't shake, I won't move, I won't shake my neck and back out. I cry when picked up, I grunt when I get picked up, my legs start crisscrossing. Those are the reasons that we want to see. It's always tough for us to say, well, gosh, why are these dogs doing this afterwards? I don't know. Is it that she's experiencing something different? I always wonder, is it something more with the owner side of it? Now that this has happened with my dog, just I'm so
freak
freaked
out
out
at everything.
at everything that she does.
Yep.
So from what I can hear, it sounds like she's doing well. I would, when stuff like that happens, take deep breaths. But the things that I would be looking for that would prompt me to say it's not going the way that we should are, I'm shivering. I don't want to move. I'm grunting.
Like she was on Halloween. It was so obvious.
Exactly. And that's kind of the very, like your neurologist said, gosh, those are really mild symptoms. That's kind of the beginning.
I didn't know that.
Earliest steps. Obviously, if something dramatic happens, we're not walking, we're scuffing our toes. Yeah, that's something that we prefer to see, especially a French Bulldog, right away.
I really appreciate all of your posts. Once this happened, I didn't know a lot about IVDD, so I started reading up on it, and I'm in Connecticut, and I love my neurologist and it's great, but I really appreciate all of your posts and everything, and it's been super helpful. So thank you so much.
Yeah. Was it who was your neurologist?
So I went to Piper. It's Dr. Ben Olson.
Okay, I thought you were going to say at Piper. Dr. Hammond and I were intern mates. So I was about to get all excited. So.
Yep. So I know of him, but Ben was the one that did Fira's consults and her MRI, and they know me very well. I sent them an edible arrangement, all these things. They're like, "Lady, your dog didn't even need surgery. Don't worry about it."
All right. Well, thank you for taking such good care of her. Thanks for getting on today.
Thank you. Have a great day.
Bye.
Bye.
Yeah.
All right. What a lovely lady.
Yeah.
Have some questions here in the comments. I'll sort of fire them off at you. Neely says, have you used acupuncture with sutures in acupoints? We've used acupuncture a lot for some of our neuro cases in rescue. Just heard of using sutures in the acupuncture points also, and we're intrigued to learn more. So I guess I'm sort of into. So the short answer is no. I haven't. Most of the neurologists that I work with, are kind of very, very Western trained. We don't do a lot of acupuncture. It's not that we're against acupuncture or anything like that. It's just that we don't have the training in that. So there are neurologists that we've worked with. There are rehab and holistic veterinarians in the area that we work with that we have a great relationship that I know they do things like the gold beads and sometimes even I think more like a plastic bead. The short answer is it's a little bit outside of our wheelhouse with regards to answering this question. And personally, I have zero experience putting in whether it's an acupuncture needle, a gold bead implant at an acupuncture point, or a suture at the acupoint. So. Anything to add?
No, I have nothing to add. That would be probably, like you said, outside of my scope of training. And so I'd leave that opinion to the people who definitely know more than I do.
Patty has a question about her dog that had an ANNPE in April. So for those of you that don't know what an ANNPE is, it's an acute non-compressive nucleus pulposus extrusion. So it's like a disc herniation, but it's a small amount of disc that comes out and hits the spinal cord and causes, for lack of a better term, a bruise in the spinal cord, but it's not physically squashing the spinal cord, so surgery isn't usually necessary. So it's kind of a bruise. We treat it with time and physical therapy and just kind of let that bruise go away, and most dogs do really, really well, but sometimes they can have residual deficits, which is where Patty's question is going here. So my dog had an ANNPE in April. He's still having bowel incontinence. He has a large fatty tumor on his rear end area that is getting larger. Vet doesn't seem to be concerned about it. Should I get a second opinion? His back, lower legs are still a bit dyskinetic. So I'm reading this as, I think the main question is, what should I be doing about the fatty tumor? But I'm envisioning from this question that we're walking, We're still a little bit incoordinated in our rear limbs. We're having some bowel incontinence. And I'm going to go one step further, that there's a fatty tumor, but the fatty tumor isn't getting in the way of the pooping. Do you want to take a crack at that, Dr. DiVita?
Yeah. So the kind of like you mentioned in your little intro about ANNPEs, dogs certainly can have some residual deficits, like you said, kind of the same as some of the conversations we've had today. If we reach 90 or 95% full functional recovery, there can still be some weakness, some wobbliness, things like that with any neurologic condition. As far as the fecal incontinence, I guess my main question, which we probably can't answer, is did that start at the time of the ANNPE? Was it before or after? Because maybe there's another cause for the fecal incontinence. Unfortunately, again, they can have residual deficits. And I guess part number 2 of the question is, did we prove an ANNPE with an MRI scan? Or again, do we have to be worried about something different that would cause that, kind of continuation of clinical signs, even in the improvement of some of the other clinical signs, if there was more profound weakness in the back legs initially. As far as the fatty tumor goes, depending on where it is, they can invade into some of the structures that do affect the back legs, but it doesn't sound like that's the case based on your veterinarian's, input. And obviously we'd have to kind of let them take the reins there, since they're the ones who are able to physically evaluate your dog and examine your dog. So I guess the long and the short answer to that question is, yes, dogs can have residual deficits. I'd want to be sure that we did a full investigation into the cause for the weakness and make sure that there's not another cause for the incontinence. And then as far as the fatty tumor goes, probably unlikely to be related, but just have your veterinarian, of course, keep an eye on that, make sure it's not growing, doesn't become painful or anything like that.
Great. We've got kind of 2 questions here, or 3 questions. One was just saying, will you talk about seizures? Then 2 questions kind of in a row. Are there any new treatments for seizures in dogs? And then a question about status epilepticus. Rachel, who I believe we talked to either last time or 2 times ago, always heard that status epilepticus is an emergency. Is it possible for animals to stop status epilepticus on their own without any intervention?
So seizures in general, or status, or which point do you want to touch on?
I guess any
of the
new
above?
treatments, or I guess how do we? Gosh, it's hard to answer. New treatments for seizures. It kind of all depends on where you're starting off of what is new. I guess compared to when I finished veterinary school, the new things are things like intranasal midazolam. Back when I was in vet school, it was all rectal Valium. So to stop status epilepticus, so I guess I should have done this last and segued into the status epilepticus thing. But it used to be rectal Valium, which still has its place, but intranasal midazolam with kind of an atomizer that kind of makes it into a more of a mister or spray has been shown to actually work faster and work a little bit better. And for me, it's just easier to. There are several advantages to it. So that's kind of one of the things that I guess has changed since I was in veterinary school. But there's still a place for rectal Valium. Not to say there's anything bad about it. Also, just things like Keppra, zonisamide, things that were new back then, are kind of very, I won't say commonplace, but are very much part of our everyday seizure treatment. I guess the hot topic nowadays is things like CBD oil for seizures, and I kind of touched on that before, and it kind of comes up very frequently in our talks. Right now, currently, Colorado State is doing a study. They did a study that I think came out June of last year that looked at a small number and of is it feasible, and is it worth looking at in a larger number of dogs. So that's the current study that's going on, where they're looking at dogs that are getting placebo and dogs that are getting the CBD oil. They've all are getting MRIs and are all already on conventional anti-seizure medications. So that's kind of one of the new things that we're eagerly awaiting the results of that. But for Rachel's question, animals to stop status epilepticus on their own without any interventions. I guess you want to kind of talk about status epilepticus and what our approach would be, and I think in there would be Rachel's answer.
So status epilepticus is a basically continuous seizure activity for a time period, and the definition is a time period greater than 5 minutes. So seizures are abnormal electrical activity in the brain. So status epilepticus would be that continuation of abnormal electrical activity on a continuous basis. You can have status epilepticus that doesn't even present itself as outward seizures. That would be what we call non-convulsive status epilepticus, and is really difficult to prove from the outside. But either way, the short answer to the question is yes, it's absolutely an emergency. So we want to stop that seizure activity, that abnormal electrical activity, as soon as possible. And the reason for that is because the longer we let that abnormal electrical activity go on, the harder it can be for us to stop it, even here in hospital. That can be the situation where seizures can unfortunately, become more serious and become more fatal. So we're typically telling owners, if a seizure is lasting longer than 2 or 3 minutes, you should be getting in your car. Minute 4, you're calling us while you're driving to the hospital, basically. So, if you have a dog that's having seizures, or a dog that's having seizures for longer than, a few minute time frame, the absolute recommendation from our end and for our patients and pet parents is to head on into your closest emergency room so that we can, again, kind of nip that seizure in the bud before it becomes a bigger issue and before it becomes more difficult to control from our end. So I think that was all of the questions wrapped in one, but I don't remember, honestly.
All right.
Ooh.
So this is fancy. I'm figuring this out as well. So Sarah asks, would you be concerned about a dog who has rapid eye movements when sleeping, also growls in her sleep while dreaming? She had an ear infection with had inner ear infection, secondary meningitis with vestibular disease. A year and a half ago was treated with total ear canal ablation and heavy antibiotics for 3 months. I read a study that suggested this could be a neurological issue, maybe caused by infection. So we'll occasionally get this question about, my dog, getting aggressive in the sleep, growling, having these really heavy dreams. Sometimes it's more centered around, the question of, is my dog having a seizure? I mean, there can be these really dramatic paddling. And to me, if your dog is sleeping, it's not, foaming at the mouth, and it's sleeping and having these REM and, the movements, the growling, the barking, the chasing squirrels, etc. That's another thing. Just kind of take a deep breath. It's probably not a whole lot of anything. I guess I've never seen it be related to as a complication of ear infection, otogenic abscess and meningitis, a secondary effect of total ear canal ablation, which is a surgery to remove the ear when there's this deep infection, or of antibiotics. If it's been a year and a half, otherwise, Sarah, your dog's doing great when he or she's awake, or when she's awake, she's running around like normal, but just you're noticing kind of this deep sleep and running, paddling, things like that. I would not have a huge worry about it, but if something changes, if it sounds more like seizures, if we're urinating, defecating, if they're happening during the middle of the day, kind of out of nowhere where we're not sleeping, if we're starting to have problems with the ear again, we're seeing things like head tilt or droopiness on one side of the face, or scratching or pawing or pain, those would be the reasons to head back into your vet to get that checked out. Anything?
No, I think that's a good summary. This is so cool.
Heather, my 8-year-old Brussels Griffon has Chiari malformation and degenerative disc disease. He had surgery at 2 years of age, so he had surgery 6 years ago. He got a meningitis diagnosis back in August. Before that, we were on Rimadyl, and it worked wonders. Now we're on a constant dose of steroids, and he's really declining with function and bowel and bladder control. I'm told the dose of steroids should help as much as Rimadyl, but I'm not sure that's the case. Can you ever really get off steroids completely to go back to the Rimadyl? So I'll take a crack. So I guess one, and I know it's not your question, but I don't think the meningitis diagnosis in August has anything to do with his disc disease or his Chiari-like malformation. You and your puppy are just unlucky that you've had to see a neurologist for 3 different problems. So meningitis, so Chiari-like malformation, degenerative disc disease, many times we will reach for Rimadyl, which is a non-steroidal anti-inflammatory first. So non-steroidals, one, they are helpful for these first 2 conditions. And they don't have quite as many side effects of drinking, peeing, panting, increased appetite, weight gain, etc., that things like prednisone and steroids can have. So my assumption is that's why Rimadyl was reached for before. When we have a diagnosis of meningitis in dogs, especially Brussels Griffons, is typically autoimmune in origin. So not like people where we get it from a mosquito bite or it's infectious or anything like that. So typically the treatment is suppressing the immune system. So high doses of prednisone suppress the immune system, whereas Rimadyl or nonsteroidals do not suppress, at high doses are not immunosuppressive. So that is the reason that your doctor's reaching for prednisone right now. We don't like to mix nonsteroidals like Rimadyl with steroids like prednisone because it can cause very, very severe complications like GI ulcers, GI perforations, bleeding in the stomach or intestines, things like that. So we don't like to mix the 2 of them. I'm sure you know that, Heather, but that's the rationale. So to get to your question, I'm told the dose of steroids should help as much as Rimadyl, but I'm not sure that's the case. I'm not sure what the dose of steroids you're giving. I guess in my experience, steroids usually are more, let's say, powerful, but do sort of, I guess, help from a pain standpoint as much as a non-steroidal. Can you ever really get off steroids completely to go back to the Rimadyl? We're starting to get into the realm of, I've got questions upon questions of the specifics of your dog's case, but assuming your dog has been diagnosed with meningitis through MRI and spinal tap, assuming it's autoimmune meningitis, typically autoimmune meningitis is a lifelong treatment. So at Southeast Veterinary Neurology and kind of all the neurologists I've ever worked with, most of us never stop steroids. These dogs are on lifelong therapy. There are exceptions where we can get the dogs off of steroids, but it's usually not our choice. It's usually either they've got such bad effects of the steroids, or they've got another condition going on that requires us to take off steroids, or we've sort of lost contact with the owner and they've stopped steroids, and then we reconnect down the road and they're like, oh, my dog's off steroids. So for what I'm envisioning as a diagnosis of autoimmune meningitis, typically I'm never stopping steroids. I'm trying to slowly find the lowest dose that controls the signs. So if we're declining in function, meaning neurological function, ability to walk, that to me is a reason to go back to your neurologist. If I were managing your pet and things were getting worse, that's when I want you calling me to say, hey, the treatment that you prescribed last time I saw you isn't working. My dog's getting worse despite the medications you prescribed. That's where I'm going to want to reevaluate, consider adjusting the dose of steroids. But usually if we're getting worse, my adjustment is going up, and then potentially adding additional immunosuppressive medications. But again, a lot of that is based off of how this was diagnosed and what the actual diagnosis is. Dr. DiVita?
I think that was good.
Okay, I'm going to let you read this and close my mouth.
Perfect. My cat was diagnosed. So this is from Judy. So my cat was diagnosed with hyperesthesia syndrome 1 year ago. He's been on gabapentin for most of that time. About 2 months ago, his symptoms abated and we weaned him off of the meds. Is he in remission or is it gone? So just to chat a little bit about feline hyperesthesia syndrome, that's a condition that's not super well understood in cats, but is thought to be a combination of neurological disease, dermatologic disease, as well as sometimes behavioral disease also. So a lot of veterinarians, neurologists, and other specialists will use a variety of medications to treat that syndrome. And a lot of times what we see for our pet parents who don't know what that is and aren't familiar is we'll see cats having these episodes of acting super abnormally. Sometimes they will kind of seem to freak out, for lack of a better description. Sometimes they will start to kind of inappropriately attack their owners, attack inanimate objects around the house. Sometimes they'll even start to do things like bite at their back end, bite at their flanks and their legs, or unfortunately self-mutilate. So it can be pretty severe. Obviously, super glad to hear, Judy, that your cat has responded really well to the gabapentin and has been able to wean off successfully. I guess I haven't seen a ton of cases where we're able to successfully wean off of medications. Sure, they can go into a remission. Obviously, I'd watch your kitty cat really closely and, just make sure that we're not seeing recurrence of those signs. That lets us know that your cat needs that medication to do well. But I haven't seen enough cases to know if they typically completely resolve. And the ones that I have seen have unfortunately not completely resolved, and we've had to keep them on medications on a long-term basis. I don't know if you've seen more than I have, Dr. Wong, and have seen them be able to come off of medications completely, but that hasn't been my experience in the limited number that I've seen, at least.
Sorry, I was noticing that I accidentally clicked on someone's thing and it was showing up. So I guess my approach with this particular pet is, if we're 2 months off, it's hard to answer the question of are we in remission or are we cured? But if we're, a year into the diagnosis, 2 months off of treatment and things are going great, to me, I don't want to oversimplify, but if it ain't broke, don't fix it type thing. I would hold off on the medications. I would keep a close eye, and we've always got something to go back to that's worked in the past if we need to. So that would be my approach for this puppy. And sorry, the other thing I was doing was looking at the time and trying to see if what our last question should be. And the next one in line here was Lydia's. Make sure I do that. After my dog finished heartworm treatment, it was all clear one day, started having seizures, could also have been brought on from the heartworm treatment. So I'm reading this as the imidazide heartworm treatment as opposed to heartworm preventative.
Yeah, that's what I would also, I guess, interpret it as. Obviously would want a little bit more information in regards to the age, breed of your dog, history, things like that. There are some dogs that can have a genetic abnormality that, predisposes them to neurologic signs with the preventative heartworm treatment. So with more of your monthly heartworm treatments. As far as imidazide goes, I don't think that's in that category of medications that is typically associated with seizures. So I would have to, hedge on the side of, not totally blaming the seizure on the treatment. But obviously I'd watch really closely in the future. We don't treat heartworms super, super commonly, but I do know when you have heartworm treatment, the heartworms can kind of die off and can cause a stressful response within the body. So sometimes dogs that were going to have a seizure, if they're, let's say, an epileptic dog, a stressful situation can, in some events, bring those seizures on. So it may be that they appear correlated, but are correlated for no reason other than, the body had a stress that it was suffering during or after the treatment. But I don't think there's a good direct correlation there. And hopefully your dog has recovered from those heartworms, because super important to treat it. And I'm glad you were able to provide that for him or her. Yeah, I'm not sure.
Awesome. Well, Dr. DiVita and I are going to have to run. We're the two neurologists on the floor. So I'm sure that someone is standing outside our doors right now, ready to line up. So, oh no, I'm sorry. We had one more that Emily gave here. That
okay.
So, James, wanted to know what you think of chiropractic therapy for dogs that have IVDD or other disc-related issues. I'm a member of an IVDD group, and there are people advocating this without any data to back up their claims. They also state that they use chiropractic therapy as a preventative measure against disc-related issues. To me, this borders too finely with holistic practice, which is fine, but doesn't provide the scientific feedback I'd like to hear. My neurologist has taken the stance that this practice is to be avoided, especially in the case that a dog has been diagnosed with IVDD. We'd love to hear your thoughts on this so I can share with the group and definitively state that chiropractic therapy has its place, but not in relation to IVDD. Thank you for your time. So,
that was really nice of them to write thank you. That's what I was thinking. So in regards to, and we've kind of touched a little bit on alternative and holistic therapy today, so I'll keep it as short as possible. In regards to chiropractic work, I guess I'm of the camp that kind of agrees that there isn't a ton of peer-reviewed published research. However, I would bet that we're hedging on, as more veterinary chiropractors become available, would bet that we're hedging on that research becoming available in the future. However, at this juncture, for a dog with IVDD, we want to avoid higher impact activities. We want to avoid sudden movements, things like that. So specifically a dog that has been diagnosed with IVDD, I would probably stick away from the purely chiropractic work, but I would encourage the other adjunctive therapies. So rehabilitation, aquatherapy, hydrotherapy, laser, massage, acupuncture, those are all things that we, even though we don't particularly practice them, myself and Dr. Wong aren't trained in some of those therapies in specifics. We absolutely work with a lot of our local rehabilitation veterinarians, and even a nurse in our hospital who provides those services as well, and believe firmly in that alternative therapy too. So I guess that's the short version of the answer is that I'm not sure I would be strongly recommending chiropractic therapy for a dog with diagnosed disc disease, but would recommend some of the other therapies in most situations.
and the rationale behind a lot of it is just, dogs are not small humans. Their discs are different than human discs. The sorts of disc herniations that dogs get are different than the type of disc disease that people get. The likelihood of paralysis, or in some cases that are severe enough of actually dying from it, are higher than in people, just based off our anatomy. One, of the disc; two, where the spinal cord ends in a person, whereas it ends in a dog, where the discs that bulge in people are versus where the discs that herniate in dogs are. So those are all the things that sort of add up to most neurologists' hesitation of saying, yes, chiropractic adjustments are a part of our repertoire for managing disc disease or suspected disc disease in dogs. I think that's kind of the other, so many times in, especially on the IVDD groups that I'm on Facebook, so many times there's this assumption that it's a slipped disc, but no tests have been done. And I'm sitting there reading it thinking, dude, this Sorry, it's been long enough to do it on the internet. But hey, I think it's less likely that this dog actually has a slipped disc. So that's just one of the other concerns with it is, do we assume that it's a slipped disc and jump past all of that stepwise thought process of diagnosing it as a disc and go straight to the the treatment that doesn't really have, like Dr. DiVita said, anything to back it up right now, which I believe was your question is there any proof? And currently there is not. Okay, now we're done. Now the line is longer. Thank you for everyone. I hope this was useful. I apologize to anyone that we didn't get to your questions. I'm sure Emily will be reaching out to see if we can help you in a future one. I believe the 21st. We're doing this
Next week. Next week.
Next week. I will be here. All righty.
Bye, guys.
Have a wonderful day. Bye-bye.
Have a good day. Bye.